My name is Steven Sizemore. I am a licensed professional counselor and a primary therapist here at Pathlight Mood and Anxiety Center. Specifically, I'm working out of the Woodlands, and I work with our partial hospitalization community, both with adults and adolescents. And my role is providing individual, family, and group-based psychotherapy services to our patients at the partial hospitalization level of care. So tonight, we really wanted to take some time and really just provide some education to caregiver burnout. This is something that we see, really prevalent in all of our levels of care with our support systems and our caregivers who are supporting our patients, both at the Eating Recovery Center level of care and both the Pathlight Center of Care. So we really wanted to take some time present some education about recognizing burnout, how we can prevent and both support that burnout, and then also saving some time at the end for Q&A so we can really just connect on the subject. But with that, I'll get us started. So tonight we're going to be discussing recognizing caregiver burnout, going over strategies for prevention and support. So we wanted to start off by just educating on what is Eating Recovery Center and Pathlight to those that are new. So really what we are is we are a national leader in eating disorder, mood anxiety, and trauma-related disorder treatment. We offer specialized care from the intensive outpatient up to the inpatient level of care. We have 37 physical centers across the country, and we also offer virtual treatment. We offer free consultations as well. And those are things that are done with a master level clinician. And we really want to cover the 3 phases of treatment. The first phase of treatment is assessment that we can see here in the bottom left corner. We really want to identify the right level of care. So we offer a free assessment with a master level clinician that will take them through guided education, really find out what is going on with that individual's unique needs, and then helping them identify and placing them in the right level of care. We have a variety of levels of care from a virtual intensive outpatient treatment to partial hospitalization, residential, inpatient. So we really cover the continuum of care. We try to offer an evidence-based form of treatment at all our levels of care. We cover a variety here from dialectical behavioral therapy, emotion-focused family therapy, exposure response prevention, cognitive behavioral therapy, acceptance commitment therapy. We also offer some trauma-specific styles like cognitive processing therapy as well. After treatment, one of our major goals and something that I think that we do a very good job at is providing aftercare plans to each one of our patients. We want to make sure that as they step back into the outpatient level of care, that we can find them the right fit as far as a community clinician, resources, but also offering services like this, both alumni and family support groups that they can join throughout the week to really just continue their support and continuing following up on their treatment. Because treatment is something that is never linear. It's something that takes a lot of proactive management. And really, we want to try to offer a variety of different supports kind of throughout that continuum of care. So with that, we're going to be talking about our agenda for tonight. We want to go over just an overview of caregiver burnout and what is caregiver burnout. We want to learn how do we recognize in ourselves those early signs of burnout so we can respond proactively. We're going to talk about the impact of burnout, not only on our caregivers, but also on their loved ones that we're providing care for. And we also want to go over strategies for prevention and support when it comes to managing things like caregiver burnout. At the end, we'll talk about some available resources for caregivers that we offer here through like the ERC and Pathlight network, as well as just general strategies and resources that could be helpful for just the general community. So what is caregiver burnout? Caregiver burnout is really emotional, mental, and physical exhaustion from caregiving over time. This can lead to things like chronic fatigue, increased stress and anxiety, and it can actually reduce the quality of care that we're providing to that loved one, right? So this affects the caregivers of individuals who have chronic physical, or specifically in this case, mental health needs and challenges. This is especially common in caregivers of individuals with mood, anxiety, trauma-related disorder treatment as well, due to many things like kind of the instability and a lot of the ongoing kind of providing support, right? So there's a lot of unique needs that mental health can really present And it can really take its toll on caregivers if we're not proactively managing and meeting our own needs over time. So it can really affect us on a variety of different phases from emotional, mental, and physical exhaustion. A lot of the common risk factors of burnout kind of come in multiple phases. One of the common risk factors that we often see is emotional strain. So this is a substantial emotional demand put on us by our role as a caregiver. Some of these things can be constant worry and anxiety about the loved one we're providing support to. It can be emotional and physical exhaustion from providing that ongoing support, meeting our loved one where they're at, and just providing that support in a variety of different ways. It can really take its toll emotionally. And the chronic nature of mental health disorders, are generally just a risk for burnout in themselves. They can require long-term and ongoing support and management. And there is a level of unpredictability with some of these episodes and challenges that can come with mental health. So, with a variety of that can lead to just a common more risk for burnout. Lack of respite is one additional kind of common factor for burnout. So insufficient help, time for breaks, or to meet our personal needs as a caregiver. So if I don't have time to come up for air, if I don't have time to take care of my own needs, after a while that burnout is going to set in, and that is a big kind of risk factor for some of these burnouts. And the last one is isolation. When we're providing care to loved ones, our social life can quickly diminish as caregiving consumes more of our time, our logistical energy, and our resources. So these are things that can lead to, increased factors for burnout. So we want to look for things like emotional strain when we're supporting just the chronic nature of mental health disorders, lack of respite or lack of time to really meet our own needs. And isolation and social isolation are kind of common risk factors to look out for that can lead to an increased risk for caregiver burnout. We want to know the early signs of burnout so we can be proactive, we can get out in front of it, and we can respond to these things as adaptively as we can. So we're going to look at three different signs of burnout, one of them being the emotional signs that we can look for. These are things like irritability, detachment, or feeling detached from either your loved one specifically or just people around you, and just feeling kind of numb or emotionally exhausted. Some other common emotional symptoms we can look for here are frustration and just feelings of general hopelessness or helplessness when it comes to providing support or when it comes to our view of our loved one getting better. Some physical signs of burnout that we can look at is just chronic fatigue, feeling tired throughout the day, having low energy despite getting enough sleep, having headaches, muscle tension, sleep disturbances as far as it's hard to fall asleep or stay to sleep due to the stress of worrying about our loved ones, and appetite changes. We can see an influx of appetite or a decrease of appetite. These are just some common things to look out for that can let me know I'm starting to get impacted. And the last one is some behavioral signs that we can look for. One of the ones we covered on that last slide is withdrawing from our social life. We find that we're spending less time connecting with our other loved ones. We're not reaching out to our own support systems, and we're kind of putting our needs on the back burner because we want to support our loved one as much as we can. Neglect of personal care, right? Kind of goes hand in hand with putting our needs on the back burner. We can see ourselves starting to take less and less care of ourselves, putting less kind of effort into our own appearance or into our own needs. And we also want to look at things like we call ADLs or acts of daily living. These are things like grooming, taking care of myself, changing clothes, showering, all of those things we want to look for as far as if they're becoming a chore, if it's getting more difficult to provide my own personal care. These are kind of some common symptoms of burnout we can look for. And the last ones is feelings of resentment towards the person being cared for. And I think this is a really difficult one as caregivers to deal with and also to acknowledge within the therapeutic setting. It's something that as the burnout starts to set in, the loved one that we want to provide support for, we start feeling frustration, that irritation, or even resentment towards them for their mental health challenges or just their ongoing needs for support. Right, so all three of these signs we want to be able to look for and really be able to get out in front of. So if we're starting noticing some irritability, some detachment, some frustration or hopelessness, physical signs like feeling exhausted, headaches, muscle tension, sleep disturbances or appetite changes, or lastly, some of those behavioral changes, withdrawing from our social life, neglecting our own personal needs, or feeling resentment or frustration towards the person we're caring for. These are some signs that burnout might be setting in, and these are some early signs to kind of pay attention to. We want to look at the impact of burnout on caregivers and how does that burnout really impact us as the person providing care. First one is that emotional impact, right? So the increased likelihood of anxiety, depression, and emotional detachment, right? We find that our caregivers are at increased risk for developing mental health challenges of their own due to the chronic nature of mental health and the challenges that come with providing support for a loved one or seeing somebody that you love having ongoing challenges or struggles. The physical impact can be health issues related to chronic stress, increased blood pressure, sleep deprivation, and immune system challenges, either from that lack of sleep or just lack of caring for ourselves and the increased chronic stress. The last thing we can look at is that behavioral impact, right? Reduced empathy and decreased quality of care over time. So my ability to empathize with my loved one that I'm providing care for, my patience that I have to meet them with, and really just the quality of care I'm able to provide them with will go down if I'm not taking care of my own needs and I'm not proactively responding to burnout. So these are the ways that burnout can affect us as caregivers. We also want to explore how does burnout affect the ones that we are providing care for. One of the ones that we covered in the last slide is quality of care. Burnout can lead to decreased focus, attentiveness, and compassion, right? So my ability to show up consistently every day for my loved one, to validate their emotional needs, to meet their practical or logistical needs is going to go down over time due to this burnout setting in. The emotional effect can be our loved ones might feel guilty or concerned over our caregiver's health. I find that many of the patients I work with really worry about their support system. They worry about their support system not taking care of themselves or the impact of their mental health challenges on their support system. So we find that it's really healthy for both, the caregiver and the patient that we're providing care for to be proactively meeting our own needs, taking care of ourselves, and finding time to meet our own needs so we're able to show up consistently every day for the one that we love. And the last one is strain on relationships. As these increased frustrations and resentments set in, we can have increased tension due to emotional strain on both sides. As we're both dealing with different challenges as the burnout starts to set in, right, we can have this strain on relationship and a disconnection between the one that we're trying to provide support for. And this can be detrimental not only for the relationship, but for the patient's quality of care provided or their ability to last through the care continuum. We find that support systems play such a big role in providing that support and accountability for continued engagement in care that we really find that showing up consistently is a big piece of the puzzle. So we've been looking at the early warning signs. We've been looking at how it impacts both the caregivers and the ones that we're supporting. We also want to know, what are the prevention strategies? How do we get out in front of these things? And especially if we're starting to recognize some of those early signs of burnout that we discussed. So one of the ones is setting realistic expectations with the person you're providing support to and knowing when to say no. Right. This can be a very difficult thing, knowing when to draw that line between support and enablement, and knowing when my own needs are not going to be met or I don't have the capacity to meet the needs that my loved one is asking from me. Right. So this really requires that personal awareness to know where we're at. But again, the better we take care of ourselves, the more care we're able to provide. We want to establish and schedule time for self-care and personal wellness. These are things like maintaining our hobbies, interest outside of caregiving, socializing, connecting with our own support systems and leaning on our own support systems proactively. And we want to proactively use stress reduction techniques, right? Stress is one of the major things that we see as a contributor to caregiver burnout. So we all want to make sure that we have adaptive and healthy strategies to be able to reduce our stress over time. And that can look a different way for a lot of different people, right? But we want to know, how am I reducing stress? And I want to be proactively reducing stress to be able to increase my quality of care I can provide. Delegation, being able to share responsibilities with others when possible. It's really hard to be somebody's only support system, right? So we really encourage somebody having a wide variety of support systems, different people for different types of support over time. For those that, are the only support system for their loved ones, this is an increased risk factor for caregiver burnout. So at times we want to be able to use delegation in our own life, right? Where can we lean on our support systems to help alleviate our own stress so we're able to provide that consistent care to our loved ones? And the last one is active communication with and utilizing your support system, right? So we want to lean again on that support system. We need to let them know where we're at. We need to kind of process with them what we're experiencing. And we want to be able to have our own support system so we can take care of our own needs over time, right? Communication is big, not only with our support system, but with the person we're supporting. We want to be able to have those proactive conversations on, how can I effectively provide you support while also taking care of my own needs, right? Family therapy is a big avenue here where we utilize this within kind of all of our levels of care to really make sure that our family support system is working synergistically with our patient, that they're able to lean on each other in a healthy way, but with boundaries. Seeking support is something that we always want to encourage with our caregivers. We want emotional support to play a vital role in managing the stress and challenges that come with providing consistent and effective care to loved ones. So there's three major areas we want to kind of highlight here. And the first one being open communication, like we discussed in the last slide. We want to talk to our family, friends, and trusted individuals about the challenges we're experiencing and how they impact us, right? We need to be able to process, we need to be able to have our own emotions met and validated, and leaning on our own support system can really help lessen that emotional burden that comes with caregiving. Support groups, something like this on a week to week basis, can be very helpful for caregivers to come together and be able to receive support and understanding from other caregivers. I think being able to relate to caregiver specific challenges and having somebody to be able to understand exactly what you're experiencing is so helpful. And having caregiver support groups like this one, I think, is a really good resource to be able to proactively manage that caregiver burnout, but also receiving, practical support, advice, and just feedback from other people in your very similar position. And the last is seeking professional help. Therapy or counseling can be an effective tool in managing personal challenges caused or exacerbated by caregiving roles. Right? This can help us provide our own insight and also just taking care of our own emotional and mental health needs to be able to effectively meet the needs of other people. We often use the old adage of, you have to secure your own air mask first before helping other people. And this is one of those things where if I'm not taking care of my own needs, I cannot pour from an empty cup and I cannot provide for the needs of other people. We want to be able to use practical techniques for stress relief. And stress is one of those things that we discussed as one of the leading factors of caregiver burnout. So there's a variety of different relaxation techniques, and depending on the individual, you want to kind of come up with your own routine or specific coping skills to be able to reduce stress specifically related to caregiving. Some of the ones that we often encourage and really provide a lot of information on are things like breathing exercises, stretching, self-care, meditations, progressive muscle relaxation. These can all be effective techniques in promoting stress reduction in a very healthy way, right? Daily routines could also be helpful in establishing structure and control in our daily life. So we want to establish a caregiving routine to create predictability and to reduce stress. This also helps us manage boundaries when it comes to supporting our loved ones. We need to have time to meet our own needs and time to take a step away from our caregiving role. And being able to proactively communicate this and establish these daily routines, I think helps set up that expectation for the patient, our loved one, but also for ourselves and holding ourselves accountable to continuously managing those healthy habits. And the last one is mindfulness, which is practicing staying present in the current moment to reduce worry. So mindfulness can look a lot of different ways to a lot of different people. And really, in the basic sense, it means I'm paying attention to the present moment on purpose. So this can look like a lot of different things. For some people, it could be socializing or connecting with a close friend. For other people, it could be taking a step outside, getting away from the screens and just connecting with the world around them. But really, it's those times that we feel really rooted and grounded in the present moment. And we can find different kinds of activities, settings, or practices that can really kind of promote this mindfulness. A lot of these stress relief techniques that we're discussing are also techniques that we're teaching to our loved ones across our continuums of care. We found that it's very helpful to share this vocabulary and share these skills with our loved ones to really promote that adaptive change over time. It's really easy to ask somebody to do something that we're already practicing ourselves. Could really kind of set the example of proactive stress reduction, healthy coping strategies, but also just managing our own needs over time. I find that a lot of times when we have that buy-in from our caregivers and they're engaging in their own coping skills, they're engaging in their own stress reduction activities, our patient feels a lot less stress and anxiety to have to do their own coping skills. And I find that they buy in a lot quicker when it's a family adjustment that's being made. So some resources and some support networks that we want to provide some information we want to highlight on. And these are specific ones that we're offering within the ERC and Pathlight network. Mental health support group for people of color happens at Mondays at 6 p.m. Central. These are all virtual, so they should be accessible to all. Anxiety and depression community support group happens Wednesday at 7 p.m. The mental health support group for college students or early adults happens Thursday at 1 p.m. Central. And we also have a family and caregiver support group that's happening for mood and anxiety, family and caregiver support, Monday, 1 o'clock Central. And I believe we also have this group that happens every Tuesday from 7 to 8 p.m. For caregivers to come and really kind of process what they're kind of experiencing and going through. So to recap, we want to be able to identify those early warning signs of stress, physical exhaustion, sleep disturbances, and feeling like our quality of care is being reduced. We want to proactively utilize those stress reduction techniques over time. And at the end of the day, we really want to be able to prioritize our own needs to be able to effectively meet the needs of our loved ones. Just want to say thank you guys for listening to our presentation today. And if anybody is struggling with any anxiety or depression that could really benefit from some kind of clinical or professional attention, give our ERC or Pathlight team a call and schedule a consultation. It'll be with a clinically trained clinician, and they'll be able to provide effective support and help you identify the right level of care either for yourself or for your loved one.